Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today my guest is Corenza Townsend of Louisville, Kentucky. Welcome.
Thank you for having me.
Thank you for being here. So you may not be known around the world yet, but this is one of the most well-known women in Louisville, Kentucky. I'll have you know. She is a mover and a shaker. And so the more I get to know Corenza, the more I'm inspired by her. And I had to take this opportunity to brag on you. So you don't have to feel like you got to brag on yourself. She's awesome, you guys. Look her up on LinkedIn. Do you want me to share your LinkedIn in the show notes?
Yeah, sure. Absolutely. Always happy to connect with folks.
There you go. So, I would love for you to start by sharing your experience working in healthcare. And one thing we really like to talk about every time we get together is how we can improve access to care. Mm-hmm. That's something you and I are both really passionate about. So can you tell me where that comes from in your story?
Yeah, so I don't think a lot of people know this, but I actually started off, so obviously a nurse by trade, but I started off pre-med. Got into it and was kind of like, you know what, this isn't patient facing enough. And so really passionate about patient care. To your point, really passionate about access. I tell people access is the name of my game. And so got into med and undergrad for med, and realized that I just wanted to be more hands-on and be more patient facing and more patient care oriented. And so decided to switch over to nursing. And the rest is history, right? But I come from a background of caregivers. And so even in my adulthood, in childhood, I watched my grandparents and my parents and family members take care of folks all of my life. That's just how our family was. And so even as an adult, which grateful for that experience as a child, because as an adult, I was an adult caregiver up until January of 23. I took care of my mother for about 6 years. She lived in the house with me. And so that nursing degree and nursing care and bedside decorum really kind of set in personally. So all my life I've been around caregiving. By profession, I've been around caregiving. And even though I am in leadership and I do a lot of operational work and community work, the caregiving always seems to come through in that. So.
And you really did get that honest, because it may not have been medical, but I met people who have said, if Corenza's mom hadn't fed me out, there are days I would not have eaten.
Yeah, no, absolutely. Yeah.
She was meeting needs your whole life. And so I'm really glad you were able to take care of her when she needed it.
Absolutely. And wouldn't have had it any other way.
So what are some of the things you've encountered in your journey that have made you want to improve access for other people? Like you were able to give your mom great care because you were trained, but not everybody has a live-in nurse.
Yeah, I think so. That's a big part of it. And so again, having a background in nursing is one thing, but to live through the experience of being a caregiver and having to play the family side and the professional side gives you just a different outlook. So a lot of that comes from experience. You hear me talk all the time about the difference between having a nursing degree and having lived experiences. I think the combination of the two are what made the difference. And so I tell folks all the time, in being a caregiver for my mother, had I not had access to people and resources to make sure that she had what she needed, or had resources so that I could advocate for her, she wouldn't have lived as long as she did. So my mother was on dialysis for 16 years. But she had a daughter who was in healthcare and had healthcare resources where I could phone a friend or really speak up and advocate for her in a setting where I was familiar with the space and familiar with the people. And I do realize that not everybody has access to that. And that's not necessarily fair. And so, as I say, the name of my game is access. It comes from a place of experience where, I get calls all the time. I'm sure you get calls all the time that say, hey, this has come up. I've got this diagnosis, A, what's your opinion? B, who should I see? What doctor should I see? What facility should I go to? And you can either make an educated guess, you're the expert in it, or you can phone a friend for them. And so I feel like from an access standpoint, from a patient care standpoint, from an advocacy standpoint, everybody should have access to that. You should be able to phone a friend. And by friend, I mean a provider or a nurse or somebody that has some type of expertise or access to an expertise that can really pave the way for better healthcare.
Yeah, and it can make such a difference just like knowing who to ask. Of course, uh,
Hmm.
we have those friends who they'll ask us random medical questions or,
Yeah.
hey, can I show you this? And that's not
Oh, man, you should see how many
necessarily,
pictures people send me. It's like,
oh
what
my
is that?
gosh, just
You
like,
should probably go see a doctor.
yeah, send that in my chart.
Yeah, yeah, not to me.
Um, but it can make a huge difference, like because some
Hmm.
hospitals are equipped for caring for different things. Like we have a hospital that's better for brains and one that's better for hearts.
Hmm.
And it's important to know that so that you go the right place and get it promptly,
Yeah.
especially for time sensitive issues. And so,
Hmm.
but then there's also financial barriers to care. And
Trust.
yeah.
Yeah, trust, education, all of those things are barriers. It's not just who you know.
Mhm.
It's what asking the proper questions and being comfortable enough to ask questions, even when you already have access to it, right? I can have access to you all day long, but if I'm not asking you the proper questions, you can't read my mind. You might be able to prompt me a little bit, but if you don't prompt me in a specific way, I'm not going to be able to tell you what I need. So there's a couple of things there, the physical aspect of access, and then being able to trust your providers or trust those around you who are providing your care, and then having the knowledge to ask the right questions or to speak up when something doesn't feel right or you just don't know.
Exactly.
Yeah.
So, what are some ways that you have learned to improve access to care in your current role that you would like to see made available in other areas?
Yeah, we talk about in nursing having a questioning attitude. And it's really not a questioning attitude, it's a curious mind.
Hmm.
And so having a questioning attitude can sometimes come across as, you know, questioning somebody's ability or their intelligence, whereas having an inquisitive mind is more so like, talk to me about that or explain a little bit more of that to me. And sometimes it's not the what, it's the how. And so, in my experience, I can tell you, even just from a leadership standpoint, if you take nursing out of it, right? If I'm talking to the layperson, how I present my questioning attitude is the difference in the response that I get and the outcome that I get. And so, it really boils down to the how and not the what. Because I can ask you, how was your day? In one way and say, hey, Rosa, how was your day? And you would just give me all the information, right? Rather positive or negative, you would just answer the question because you don't feel, threatening or that I'm threatening. If I say, oh God, Rosa, so how was your day? It sounds like it's an assignment of me to ask you that question and you're going to put up a
Check
wall.
that box. Yeah.
Yeah, yeah. So, in order from a patient care standpoint, and just from just being a good teammate and partner, how you ask questions and have that inquisitive mind, is important. And I think it's the learning from other people's mistakes, right? If you're in a room and you see how people communicate with each other, if you come across as a jerk, you're going to get less than an answer. It's really boils down to
But you're
something so
also,
simple.
yeah. Well, one thing I love about you is you're willing to take a risk of being seen as maybe disagreeable. I haven't seen
Hmm.
you be disagreeable, but part of that curiosity is asking
Hmm.
questions when the agreeable thing would be to just smile and nod and go on with the
Yeah.
status quo. And so there are times when we need to question the way things are done so
Hmm.
that they can be done better, right?
Yeah, yeah. It really boils down to the person or the people that you're dealing with. It so many times we take things personal or we make things about us, and it has nothing to do with us. You just never know what kind of day somebody's having, or what happened behind the scenes that brought them to the decision making or the process that they chose to go with. And so, just simply asking questions and saying, using humility and saying, I don't understand why we're doing it this way. Can you explain it to me more? Or, you know, it ain't broke, so we don't really have to fix it, but that doesn't mean that we can't improve it. Let's talk through it. Here's a couple of ideas. Give me some of your ideas. And I always ask people all the time, in utopia, what would this look like? Man, does the answer change. The process is never even the same. And so how many times do we get stuck in well, that's the way we've always done it. And so, it's the path of least resistance. Let's do it that way. Well, is it best for patient care? Is that what brings the best outcome? You know, that's what's easier for you, really, or is it just what's mindless for you to do because you've always done it that way? Like, let's just talk about it. Let's throw around a couple of ideas. And when people get those juices flowing, man, does it make magic.
What are some good ideas that you've seen come from your pursuit of curiosity and fostering that in your team?
Um, Honestly, I am really big on data. And so seeing metrics change is a big one. Of course, and from a nursing perspective, quality is a big one. So outcomes are really important. I'll give you an example. Working on a process now, on a project that I'm working on. And it was a simple question of um, HIV and AIDS testing, which can be very taboo for people. And so here in the state of Kentucky, your general consent to treat includes testing. So there's an opt-out process. And I'm getting into the weeds a little bit, but stick
No,
with
that's
me.
okay. Yeah.
It's really, really taboo. And in certain parts of town, we say, oh, this is not the demographic that has AIDS. This isn't the demographics that might have a simple STD. They might not have trich. They might not have herpes. And so we're not going to test here. And so in the project that I'm working on, it should be a part of the workflow. And in general, it should be a part of the workflow at large. And so I just kind of asked the question, like, is it that it's uncomfortable to ask the question, or do we really feel like certain demographics just don't want to be tested? And so, when you ask the question, it's kind of like, this is really me, I'm uncomfortable.
Yeah.
And that's okay. So
Yeah.
let's work through how to ask the question. Fold it into everything else. Do you have food disparities? Is there anything that you're concerned about? We're going to run this test, this test, this test, and HIV and AIDS test. It's just a standard protocol. Are you okay with those things? If they say yes, guess what? You test. If they say, I'm not comfortable with having an HIV test, then you opt out. That's simple. And it's kind of like, well, when you put it like that, it's like, yeah, wrap it into a bundle of things. Or as a matter of fact, that's my idea. What's your idea for it? It's like, well, I kind of like that, but can we fold it in the middle of that list? Absolutely. There's nothing wrong with that. There's nothing that says that we can't. As a matter of fact, type that up for me. Let me see what that looks like. And then they get to going. And then all of a sudden it's like, man, that was a really, really good idea. Can we use your idea? All of a sudden they're leading the project.
And I love that.
You're
You're
doing
just
great
like
work.
building up other people to be leaders instead
Yeah.
of like taking somebody else's idea and taking credit for it. You
Yeah.
really raise up the other people on your team.
Mm-hmm.
And that's one thing I really love about you as a
Yeah.
leader, is so that if at some point you are ever not the one leading that team, you've already created a team of leaders.
Yeah, yeah. And really leading has nothing to do with it's not me. I'm not the leader, right? To your point, if I fall off the face of the earth, whatever we're working on needs to keep going because, 20, 30 years down the line when people aren't doing podcasts and they're floating around in the sky talking to people and reminiscing about the work that you did, they're looking around like, they're Corenza who, like my name's not going to be on a billboard somewhere, but the work that we accomplished will be, and it'll be best practice for somebody, and they'll advance that, and they'll do better things down the line. So I want to be a part of. That's all it is, just a part of.
And that's a great thing about legacy. Legacy's not having your name on a building. It's making a change that has a ripple effect or like a
Mm-hmm.
snowball gathers
Yeah,
momentum as
our
it
kids and
rolls.
their kids.
Mhm. Exactly. So we're coming down to the $1 billion question, Corenza. Are you ready for this?
Let's go.
Okay. So you have seen so many things that you would like to change and have taken steps to improve. But, there's always resource constraints. Now, in the event that you had a grant or something for $1 billion, how would you like to see that used strategically in healthcare to meet the needs that you've seen? How do you think it could be used the most effectively?
Oh gosh, education around resources. And so we talk about education all the time. We talk about resources. We talk about access, but you cannot have access to something and not know how to utilize it or how to use it, or where to put it or how to open it, all the things. And so I would say strategically around educating the resources that we have, And in addition to that, because it's $1 billion, and honey, who doesn't want to spend a whole $1 billion around access to the resources that are normally just put in one place? And so I'll give you an example. I am
Yeah.
not the queen of DEI, but my book of business that I'm in mostly falls around the minorities because those are just the areas of need and the work that I do. And so you hear me say the game for me is access. It's not, diversity and inclusion, although I think that's good work. For me, the game is access. And so if you look at, and like I said, we're in Kentucky, if you look out at any outlying county outside of just in our backyard in West Louisville, if you look at any outlying county, that demographic and those statistics are the same. We have resources for certain areas of our city, and we have education for certain areas of our city. If we don't educate the people who are giving the resources, the resources won't be the right resources. So, right. So I can't assume that, Rosa, you need a certain resource because I just looked at you or I just took a wild guess. You might need something totally different. And so educating the me in this to say, well, you need to have that inquisitive mind and you need to do the research and ask the questions of the community that you serve. That money going into educating the people who are doing the work and the resources to the people that need it, I think we would easily run through $1 billion.
Yeah.
And we'd be able to look at those metrics.
Yeah, definitely. So I think you touched on one of the ways that you did that with community surveys, right?
Mm-hmm.
So
Yeah.
how does an effective community survey work?
Absolute great question, and we can roll that into the $1 billion because you would need funding for that.
That would be part of it.
So
Yeah.
I know it. So we look at doing a survey, and the easiest thing for a demographic of me and you would be to send an email, right? We check our emails all day and all night. It's on my phone. It's the work that we do. It's part of our everyday life. We check our emails.
Here's a Survey
And
Monkey email.
okay, like everybody loves a little survey monkey. I'm gonna start handing out bananas at this point. But it's easy to email a survey. It's easy to go to, a community event and hand out a survey. It's easy to go to a physical place and hand out a survey. But usually the true answer lies in none of those places. In order to get a true capture of the information that you need, you've got to go to the people. And so I mean a good old fashioned printed out, go door to door. It's the guerrilla marketing of research. And so speaking from experience in doing that, the feedback that I've gotten on the project that I'm currently working on, the majority of the answers that may have surprised you came from the 4,500 physical surveys that we did, not from the survey monkeys and the scan this QR code. We missed the demographic of people, and I don't mean racial or sexual orientation. I mean gender. So grandma doesn't know how to scan the QR code. Grandpa ain't
You've
checking
got
the email.
age, you've
Yeah.
got more
Mm-hmm.
like physically
Religious
limited,
background,
homebound.
physical,
Yeah.
disabilities, the whole nine. And so we've got to think through that, when we say your layperson is a wider demographic than just your regular person walking down the street. Some people are homebound. How are you getting to those folks? And so in order to do a proper survey, you've got to be mindful of physical disabilities and different demographics that we normally don't reach.
Yeah. And since one of my passion projects is improving stroke community health education, and stroke being one of the leading causes of disability.
Yes, that's a
Thank you
physical
for
barrier.
that. Yeah.
Yeah, it's a physical barrier.
Well, and or it could be a cognitive barrier
Hmm.
and make processing things like using technology more difficult,
Hmm.
whereas they could answer like yes or no questions if you asked them in person. So
Yeah.
thank you for making that personalized.
Yeah. And side note, having the patience to wait for somebody to answer that. So we talk about cognitive barriers. Sometimes the cognitive barrier isn't that they don't get it or don't understand. Sometimes it's a delay. And
Mm-hmm.
so as you're doing this, the humanism of having the patience to go through and help people, do something like a survey, you got to keep that in mind too. Sorry, I'm on a soapbox.
That I did invite
On a
you here to
soapbox.
get. I invited you here to get on your soapbox. Okay,
Yes,
this is your
yes. I'm
time.
all about the people, and that means everybody. That means
Yeah,
everybody.
it does. And so, like, so much of Kentucky is with where we are, is
Hmm.
a rural area. Like there are two big
Yes.
cities really, and then most of the rest of the state is really
Mm-hmm.
rural with very limited access to care. And so, any lessons that can be learned from the projects you've been working on that can be like scaled up to the state level, I would really love to see.
Oh,
So, the
yeah.
community surveys, as well as recognizing, oh, EMS can't get there within 15 minutes in this big city. Well, what about when it takes an hour in one of these outlying
Mm-hmm.
counties? Like,
Yeah.
let's talk about that. But
Yeah. And it's simple, simple everyday life thing, access to power and water. We have a bad storm. We see it all the time. If something floods or there's a bad storm, it's easy to bring back up a metropolitan area, but they're on a grid. These outlying counties are, if a power line goes down, they're out. What measures are we taking from a healthcare standpoint to make sure that these people have the access that they need to? So it's all encompassing.
yeah, exactly. We all need food and water and shelter, and those are the basic
I
things
definitely need
for
food.
humanity.
I gotta have
Let's
food.
not forget. Oh my
No, that's
goodness.
all the time.
Oh, that's all the time. Okay.
All the time.
Well, we'll get lunch. It'll be okay. So, so you were talking about education. We talked about
Mm-hmm.
community education as well as educating ourselves on what the community is. Were you referring to education of healthcare workers as well, or who else were you including in that?
Yeah, and so healthcare workers specifically, actually, and I don't mean sending folks back to school. I mean educating people. So let me preface this by saying we are not going to know everything. And so when I say educating people, I mean teaching people how to read the room, right? And so being able to have those identification cues, or if you're in a situation whether there's a language barrier or we talk about domestic violence sometimes. We ask people in an ED, certain questions, but if, the perpetrator's in the room and you can't read the room, you're not helping the patient. And so when I say educating people, I don't mean, just a general training or keeping up with your, with your hours and your training. I mean, literally teaching people how to remember that you're human too, and to be mindful of your surroundings and how to help people in other ways outside of just physical health care. That goes a lot further than, well, let's take a class for this. It's kind of like some of that stuff you learn on the spot. But there's people who are formally trained to teach that. And so that's the learning that I'm talking about. So many times we get caught up in the textbook, and it's so much more than that. Those life lessons that I talked about, being around a family of caregivers. There's a lot of things that I picked up from caregiving that I learned from that experience versus being in nursing school or on the floor.
And that's a lot of the learning how to have a healthier culture, right?
Yeah,
Like I feel
mentorship.
like, yeah, mentoring our way into a better culture in
Hmm.
our workplace. I feel like our work overall has a really great culture.
Yeah.
We actually practiced the 15-5 rule. We did
Hmm.
during COVID. Like it really stuck because when
Yeah.
you're 15 feet away from somebody, you make eye contact. When you're within
Hmm.
5 feet, you say hi and you smile and make
Hmm.
sure your smile can show in your eyes.
Yes. Yeah.
And
Through the
we
mask.
maintained that. We
Yeah.
maintained that so well across
Hmm.
the whole system. And, little things like that, like you said, preserve our humanity, I really
Hmm.
feel like makes such a huge difference. And it may not seem tangible and it may not
Yeah.
give you your data points
Hmm.
in a way that we know how to measure. I don't know. Did you find a way to track that?
Patient experience shows that. That's what shows
Sure.
through. It really does. That's what shows through. And we the recommend this provider and cleanliness. It's one thing to have a stuff on the wall and somebody's like, "Oh my God, the room's dirty." It's a different thing for somebody to see a nurse or a PCA come in and clean their hands, or they see something on the floor and they just pick it up and throw it away. It's perception. It's all
Yeah.
perception. So if a patient or a guest feels like you are treating them with respect and they see you doing things to keep your space clean, they respect you and the space. And I think personally, I think that shows in the metrics. I mean, personally, in my personal experience, it shows in the metrics. So, you know,
See, I need to hear that from you. I need you to humanize the metrics for me, please.
yes, yeah, yeah. And, I'm an avid Disney buff. Everybody
Yeah.
likes the big old mouse. But for the project that I'm working on, we literally took a crew of 5 people to Disney to learn what is the magic behind the mouse. And we're incorporating that in the project that I'm doing. attention to detail. It really is. And that has nothing to do with nursing. It has nothing to do with healthcare itself. It has to do with the experience of the guest that's coming through your doors. And that does sway your metrics. Yeah.
Definitely. And
Mm-hmm.
sometimes your reimbursement based on those patient experience metrics,
Listen,
right?
I tell people all the time, two things can be true. You can do good care, good health care, and you can make money. It
Hmm.
does, they do coincide.
They can
But
work
the
together.
Yes, but your good patient care and good customer service has to happen, or that reimbursement doesn't come through. So at least not in the long run.
That's true. Well,
Hmm.
thank you so much for joining me here today, Corenza. So,
Absolutely. Thank you for having me.
yeah, I appreciate you, and I'm looking forward to hearing your keynote address at our Power Up Nursing Symposium in October as well.
I'm so excited about it. I want people to slip off their shoes and get comfortable. We're gonna have a conversation.
So you say that, but I'm
Hmm.
planning to have the door closed. It may not smell very good. Can we keep our shoes on and be
Little
comfortable?
poopery. We'll keep our shoes on,
Okay, okay.
but it'll be
Anyway.
good.
But thank you for making it a comfortable space. So,
Absolutely.
and it's always a pleasure to visit with you. Thank you for taking the time tonight.
Absolutely. And I hope everybody enjoys this session and all of your other sessions. You've got a good podcast going here, girl.
Thank you. If you've enjoyed this episode of the Nurse Rosa's Insights podcast, be sure you subscribe on whatever platform you're listening or watching on. And I'll see you in the next episode.
That's one way to end it.